All right, so today we're doing a deep dive into something pretty specific.
Right.
The Ghana Standard Treatment Guidelines.
Okay.
But we're zeroing in on one particular thing, how they deal with something called STI-related scrotal swelling.
Gotcha.
Now, these are, of course, like guidelines meant for healthcare pros over in Ghana, but
Right.
I think there's a lot we can unpack here that's relevant to a wider understanding of STIs and their impact,
Oh, absolutely. I mean, even though it's geographically specific, the core info about, the causes, the symptoms, the treatments for these common STIs
Right.
often applies more broadly. It's a fascinating look at how medical experts are approaching this particular health issue anywhere, really.
Exactly. So let's jump right in. When it comes to STI-related scrotal swelling, what are the main culprits these guidelines point to?
Well, the guidelines highlight two main bacterial causes, Chlamydia trachomatis
Okay.
and Neisseria gonorrhea.
So those are the usual suspects.
Yeah, pretty much. But here's an interesting tidbit. They also mention that Treponema pallidum, which is the bacteria that causes syphilis,
Right.
it's actually a very rare cause of this specific symptom.
Huh. So syphilis doesn't usually manifest that way.
Not really. It's not a typical association, at least according to these guidelines.
That's good to know. Now, for someone who might be experiencing this, what are the red flags, the symptoms they should be watching out for?
Well, the guidelines list a few key things to look out for. The most obvious ones are scrotal swelling
Yeah.
and scrotal pain. But beyond that, they also mention things like urethral discharge,
Right.
dysuria, which is basically painful urination
Right.
and increased frequency of urination. So basically needing to pee more often than usual.
Gotcha.
And then they also include fever as a potential symptom, which makes sense.
Yeah, a sign of the body fighting something.
Exactly. It's a systemic response to the infection.
So let's flip the perspective a little bit. Put on the doctor's hat for a second. What are the physical signs they'd be looking for during an examination?
So when a doctor examines a patient presenting with these kinds of symptoms, they're going to be looking for a few specific things.
Oh.
Obviously, the scrotal swelling itself is a key sign,
Right.
and they'll be checking for any edema, which is just a fancy word for fluid buildup,
Okay.
and erythema, which means redness of the skin.
Makes sense.
They'll also be assessing for tenderness in the scrotum, looking for any discharge from the urethra, and confirming whether or not the patient has a fever.
So if a patient comes in with these symptoms and the doctor sees these signs, what happens next? What kind of tests do these guidelines recommend?
Okay, so when it comes to investigations, the guidelines suggest a three-pronged approach.
Okay.
First, they recommend a urethral swab for culture. This is basically to identify any bacteria that might be present.
Makes sense.
Then they suggest a urine culture and sensitivity test.
And what does that tell them?
Well, this test does two things. It identifies the specific type of bacteria causing the infection,
Okay.
and it helps determine which antibiotics will be most effective in treating it.
So it guides the treatment plan.
Exactly. And finally, they recommend an ultrasound scan of the scrotum. This gives them a clearer picture of what's going on internally.
Got it. So once they've done the tests and figured out what's going on, what are the main goals of treatment according to these guidelines?
So the treatment strategy outlined in the guidelines is all about tackling the problem from two angles.
Okay.
First and foremost, they want to alleviate the pain and discomfort the patient is experiencing.
That's a priority for sure.
Absolutely. And then secondly, the goal is to treat the underlying cause, whatever that may be, whether it's an STI or some other factor.
Makes sense.
And here's a really crucial point. The guidelines strongly emphasize treating for both gonorrhea and chlamydia simultaneously.
Oh, interesting. So even if the tests only confirm one, they still treat for both.
Often, yes. The reason for this is that co-infection is incredibly common with these two STIs.
Ah, so someone with one is highly likely to have the other as well.
Exactly. So a broad spectrum approach is often the most effective initial strategy.
So it's like a better safe than sorry kind of approach.
Yeah, you could say that. It just makes sense to cover all the bases, especially early on.
That makes a lot of practical sense.
Yeah.
Now, aside from medication, is there anything else these guidelines recommend for managing this condition?
Yes, absolutely. They highlight the importance of supportive care measures.
Okay, like what?
Well, the guidelines specifically recommend bed rest and scrotal support until the inflammation and fever subside.
So basically just taking it easy and letting the body heal.
Precisely. These measures help to manage the immediate discomfort and allow the body to focus on fighting the infection.
All right, so that's the non-pharmacological approach.
Yeah.
What about medications? What do these guidelines say about drug treatment?
So For gonorrhea, the guidelines recommend a few options.
Right.
There's injectable ceftriaxone
Okay.
or oral medications like Cefixime or ciprofloxacin.
And what about for chlamydia?
For chlamydia, they recommend oral doxycycline or tetracycline.
Uh-huh.
These are usually taken for 7 days. They also list azithromycin as a single-dose option.
So just one dose and you're good.
Yeah, azithromycin is a pretty powerful antibiotic. It can knock out the infection with just one dose.
Wow.
Alternatively, they mention erythromycin, which is taken over 7 days.
So a few different options depending on the specific situation.
Exactly. It's worth noting, though, that these recommendations come with an evidence rating of C.
What does that mean exactly? What's a C rating?
A C rating typically indicates that the recommendations are based on a lower level of evidence.
So not like rock solid scientific proof.
Right. It could be based on things like expert opinions, case studies,
Okay.
or maybe older studies that might not meet the highest standards of scientific rigor.
So basically it's the best they've got, but more research could change things down the line.
Precisely. It just means there's still room for further investigation and potential updates to these recommendations.
Okay, that makes sense. So just to recap what we've learned from these Ghana standard treatment guidelines, they basically lay out that chlamydia and Neisseria gonorrhea are the top contenders when it comes to bacterial causes of STI-related scrotal swelling. They highlight a bunch of key symptoms and signs to watch out for, and they stress the importance of nailing down a diagnosis through specific tests.
Yes.
And then when it comes to treatment, it's all about hitting the problem from both sides, relieving the pain and discomfort, and targeting the infection, often going after both gonorrhea and chlamydia at the same time.
Absolutely. A comprehensive approach is key.
It's really fascinating to see how these guidelines tackle this issue with such specificity. And it makes you think, looking beyond this particular condition, what does this tell us about the broader landscape of STIs globally?
Right.
Especially when you consider the different prevalence rates of these infections in different parts of the world
Exactly.
and the ever-present challenge of antibiotic resistance. It's a complex issue with a lot of moving parts,
Definitely.
a lot to ponder.
Well, I think this deep dive has given us a lot to chew on. Thanks for joining me today.
It's been a pleasure.
Always a good chat. All right, that's all for today's deep dive. We'll see you next time.